name's Professor Jari. I'm a consultant knee and lower limb orthopaedic and sports medicine surgeon, and I've been working here at the Alexandra Hospital for probably about 15 years. We have decided to set up a one-stop knee clinic here, and the reason for that really is that we all have busy lives. We don't want to have to keep coming back to the hospital on 2 or 3 occasions in order to try and get a diagnosis made. The main benefit is that hopefully the patient will come in, they will see me, and by the time they leave the hospital they will have a diagnosis as to what's wrong with their knee, and importantly a treatment plan that we can commence. So normally what would happen now is the patient will be referred, they'll come and see me, I'll assess them, examine their knee, and we'll send them away for diagnostic tests. They'll then come back on a second occasion to have, for example, an MRI scan done, and then they'll come back on a third occasion to get the results of the scan back. And at that point, the treatment plan will be formulated. The hope with the knee clinic is we can shorten that process down, and everything will be done in one day, albeit it'll take a few hours, but it'll just take one visit to the hospital. But once we've got a treatment plan formulated, if the surgery is something that they need, then I will explain to them what the surgery entails, what the risks and the benefits are, and we'll get them booked in to have an operation. It may be that they don't need surgery, and it may be that we can treat their problems with injections or physiotherapy. And again, if that's the case, then I'll talk them through that, refer them for appropriate physiotherapy, or we will discuss the injections that are feasible that need to be done and arrange that to be done. I think the main reason to come to the one-stop clinic is to try and shorten the process of making a diagnosis with whatever problem you've got with your knee, whether it's an arthritic knee, whether it's a sports injury that you've had, whether you've torn a ligament. We can try and condense that down from start to finish in one day. They'll get to see a surgeon who's got an experience of dealing with knee problems for many years. The MRI scans, if they need them doing, will be reported by an expert musculoskeletal radiologist, and then we'll have a diagnosis and can move forward with their treatment.